Hey everybody, this is Dr. Carmen Echols, family medicine physician. I help patients and their family break the generational cycle of death and destruction due to chronic disease through public speaking, patient education, and utilizing outdoors as a means of mental, physical, and spiritual wellness. This week has been quite eventful, as I'm sure many of you all already know and are aware of. As a primary care physician, focus on not just prevention. We don't want things to happen. We don't want anybody to get sick. That's why we're saying get your physicals, your mammograms, preventive health. Make sure you come in, see your doctor on a regular basis. But sometimes, despite our best efforts, or if we fail to go see the doctor, we have to deal with the fallout, the consequences of not doing what needs to be done, or sometimes external forces just don't work in our favor and we have to suffer the consequences. If you get my drift, this could actually be applicable to the current climate. So I'm just really here to give you all a little bit of light. Just want to talk to you all about 3 things that you all can do for basically maintaining your health during all this. So first things first is, if you have not gotten your physical, your own personal maintenance check, you need to go ahead and do that. You need to go ahead and do that as soon as possible. Things are coming down the pipeline, as I'm sure you see in the current administration, that could possibly adversely affect your health. You need to be as healthy as possible from the offset to ensure that you remain healthy throughout all of this. My second recommendation would be to be aware of any sort of unusual behavioral changes that you may have. You may notice that you're not sleeping as well. You don't necessarily enjoy the things you used to enjoy. You may find yourself being more withdrawn. Heck, I'm guilty. You may find yourself snacking more. Those are signs that there's something bothering you. It's not necessarily you're bored, but sometimes those can be signs that there's something bothering you. There is a sense of unrest. And it's very important to be aware of those habits. And if you can change them, if they're unhealthy habits, change the habits. If you're having difficulty changing the habits, talk to somebody, be it your primary care doctor, your specialist. Sometimes specialists can give you good insight and good direction on things. And of course, I'm a big fan of therapy, mental health. Talk to a therapist if you need to. And lastly, with the amount of information that is out there now, and the access to consumability, there is definitely very much a psycho-spiritual component to what is going on. And it's important to be aware of that. And it's also important to notice how that psycho-spiritual impact can manifest physically. I'm already talking to some of my colleagues now who are seeing patients in the clinic, especially our elders, who are coming in very vague symptoms. And it turns out that the consumption of media is actually starting to take a mental, psychological toll on them, and it's manifesting physically, whereas they're having these vague symptoms of not feeling well and they just can't put their finger on it. So it's important to be mindful of that impact as well. And I'm a solutionary. What can you do about it? Being aware of it and actually going to a professional to get it addressed. So that's all I have for right now. Share with someone if you feel like this information will be beneficial, reassuring, reminding you to just throughout all of this, take care of your health, take care of your well-being, your physical, your mental, and your spiritual well-being. The spiritual well-being can be either being aware that your soul is not at rest and doing something about it, or even understanding that your energy is off. So that's all I have for you all today. Take care. Until next time. Bye, y'all.